so much once again for joining us today and for the overwhelming response. Yet again, people from over 20 countries are joining this webinar and watching this webinar live today. So thank you so much. Today, we'll be talking about importance of motor skills in the overall development of the child. The speaker for the day is Dr. Satyaki Sengupta, who's the Deputy Director of Allied Health Specialities at KK Women's and Children's Hospital, one of the largest in Singapore. But more on him a little later. This webinar series is brought to you by Eblity. So let's know a little bit more about Eblity. For us as an organization, all the carers of children with special needs, which means you all are at the center of our universe. Our mission is to make things easier for you all. And one way that we have been trying to do this is through technology. Every child wants to thrive, and every child should be given the opportunity to thrive. And while we understand that technology could help a lot, we also do understand that without the carers, without you all, technology is insufficient. And therefore, we bring to you the Eblity community because no one should have to do this alone. The Eblity community, along with other resources, will help you enable the best chance of discovering the child's true potential. And one way you can access the resources is through our YouTube channel. So you can go to YouTube, search for EBLITY, and you can subscribe to our channel. All the past webinar recordings and over 100 useful videos are present in our channel, which could help you in some way or the other. You could also follow us on Facebook to stay posted about all the different updates, all the different resources that we would be bringing to you. Hundreds of people have already followed us. Join them and learn from one another. Okay, so coming to the speaker for the day, Dr. Satyaki Sengupta. He's the Deputy Director, like I already mentioned, Allied Health Specialities at KK Women's and Children's Hospital in Singapore. He's a Doctor of Physical Therapy from University of Michigan with over 28 years of experience in physical therapy. He's also the board member of Cerebral Palsy Association of Singapore, and he has won numerous awards for his contribution, including the Merit Award, GCEO Excellence Award in Singapore. Thank you so much, sir, for joining us today. We are so glad to have you here with us, Dr. Satyaki.
Thank you.
So without further ado, I would request you to take over. I'm pretty sure all our audience members are really excited and eager to listen to you. So over to you.
Okay, thank you very much for the opportunity to present. This is a unique topic as well. And I would try to share and try to make it as simple as possible because development of a motor development of a child and its functionality is not an easy thing. So I'll try and make it as easy, and I will be open for questions to come. Kindly allow me to share my screen so that I can go to my presentation.
Sure. Please do.
So motor skill development, all right. So I think that's the topic. And the important thing is, so motor skills are movement and actions through our bone structure. And typically they are categorized into two big categories. One is called the gross motor skill. The other is called the fine motor skill. So I think all of you know the things that we do. Just give me a moment, I reorganize how it is. So the gross motor skills and the fine motor skills, the bigger movements that happen in our body, they are called the gross motor. And the finer movements that happens in our body are called fine motor skills. So gross motor skills involves in movement and coordination of the arms, legs, and other larger body parts. For example, when we run, when we crawl, when we swim, whereas fine motor is involved in smaller movements that occurs in wrist, hands, finger, feet, and toes. So they involve smaller actions such as picking objects and And these are very critical because this gives us the ability to do much finer tasks, such as writing, playing musical instruments and so forth. So both of these two gross and fine motor movements are important because they complement each other, and together they produce a coordinated movement which is important for us to function normally and to. So this leads leads to finer functionality, which actually opens up for the development of the child. So when we come to motor development, I think the next topic that I would like to touch on is the motor development. So from birth, motor development occurs actually at a relatively very rapid stage, and particularly in the initial 24 months of the life. And we acquire a lot of gross and fine motor skills. If we compare the things that we do in the later part of the lives, I think it is a rapid progression and learning that takes place. So motor development normally usually occurs in sequence and pattern, and there are timings, so which is important. So, and there are a lot of extrinsic factors as well, which helps us to mature and learn the skills that we learn through the different motor development. And that evolves with even different influences and the cultural practices that we have, right? So if we look at the sequence that we have in a motor development, I think most of us knows from our experience as parents that, around 3 months, normally a child develops some amount of control over the neck muscles. They can lift their head. When we do a pull to sit, when you go to a doctor, they do a test called pull to sit to see whether the child lifts the head, even if the child cannot sit. So around 6 months, we are trying to sit by ourselves, a supported sitting, all right? And around 7 to 8 months, we develop supported standing, all right? And then we start crawling, and then we start cruising. And then after that, maybe around 11 months, we actually stand. And then after that, we start walking. So these are the sequences, what we call the milestones. But to be very honest, normally sometimes kids actually skip milestones. So I think the commonest is there are a lot of kids who actually does not crawl. But each of these sequences is also important for us in the subsequent stage of development. For example, if we look at the crawling, I give an example of crawling. So if we have a child who doesn't crawl, by crawling, what we get is reciprocation. That means we learn how to engage the contralateral side of that means when I crawl, I use my right upper limb and my left lower limb. So this usage of my limb in the contralaterally is learned while we crawl. We call it is, so this is important because when we stand and when we walk, we need to have this contralateral activation of our body so that we can walk properly. And that's why those kids who does not crawl, they spend a bit longer time in standing. That means they stand for a longer period, but they have to figure out how to take a step while balancing on the other leg because they have not crawled. So the reciprocation of movement, they haven't learned that much, right? So that's why it is important that each of the steps gives each of the sequence of the motor development actually prepares us for the next stage and ultimately for us to walk. So before I go to this, I will show you basically a short video. So I will stop sharing the screen and go back.
바쁜 일상 속에서 우리는 휴대폰과 컴퓨터에서 나오는 디지털 활성산소에 항상
So you can watch this video tells you the different stages of motor milestone development. So I think most of you may be aware of the milestone. So it is very important for us to go through the milestone, and the stages of the motor development actually contributes to the overall development of the child, and the sequence is very important. And later on we will come that the sequence actually can be used to basically to measure or evaluate a child whom we may think has some delay in development. And also we use the sequence in treating children, what we call developmental approach. So when at therapy, because I'm a physiotherapist by training, when we treat children who have developmental issue, we primarily use the developmental sequence as a mode to evaluate the child. At the same time, we also try and stimulate and facilitate the kids to go through this sequence so that they can learn the motor milestones and they learn the gross and fine motor skills. The fine motor skills comes later. This is primarily a gross motor milestone. And they can achieve gradually be more functional. So once we have the gross and fine motor skills, so then we also do acquire a lot of other motor skills which actually are important, and basically it is refinement of the skills that we learn. So I'm sure that you all have also noticed that learning motor skills is a process that requires practice, that requires feedback. Basically, it is a learning process. What we call is motor learning. So there is several principles which is similar to the learning theories, because I know that over here, a lot of the audience are special educators from education. So motor learning is a process which refines through practice, and we need to practice it over and over again to get it. So I think most of you have noticed that when a child learns a specific movement or a specific activity, they keep on practicing that over and over again. It comes naturally, and that's how they master that motor skills. So that's how we gradually get feedback. For example, I'm learning how to walk. So once I stand, I take a few steps, I may drop down my bum, get up again. And so all these experiences basically teaches me how to regulate my muscle, how to distribute my weight, how to shift my weight between right side and left side, how to balance, and then how I can move and walk forward. So basically, if you look at the stages, so the initial phase that we call is a reflexive period. Then we have a pre-adapted period which lasts up to 1 year. And these are quite, they actually overlap each other. Then we have the fundamental motor skills period where we learn 1 to 7 years, right? Different motor skills, but we may not be perfect, or we haven't acquired the skill to that level of accuracy. And then we get context-specific motor skills when we start doing it, right? So I can tell you that and then we become really skillful. So I can give you a very easy example how we actually learn and how we master a motor skill. So for example, if you are learning to drive a car, so initially you have to think, all the controls, where they are, where is your clutch, where is your gear, where is your accelerators, where you have to look right and left and all, how to drive. And when you start driving the car, initially you are actually very conscious. You do all these things very consciously. But as you drive and continue to drive, then you realize that all these things is automatically happens, and that's where your acquisition has been complete. And sometimes you may drive without knowing that you are driving to office, but you may be thinking something. Sometimes, in Saturday you start, every day you go to office, maybe on Saturday also you start early in the morning, you end up in the office because you're thinking of something, but you are guided to the route that you have been going every day. So this is what we call when we actually at the pinnacle of the skill, we don't have to think about it when we do it. And this all is coordinated through our central nervous system. So that is how we acquire the skills, which is so important. And this is all not only in our day-to-day activity, in sports and other activities as well. So the other important thing, I think, what we felt, especially in this cohort of children, is the cognitive development. And the cognitive development is very important. And now it is coming to light that cognitive development actually has a lot of link with the motor development. And there is a relationship in the two, because unless we have our motor development, definitely we cannot explore. We cannot explore. Our sensory development doesn't take place, and that's how our cognitive development is not optimal if our motor development doesn't take place. Right? So now that we know that the motor and cognitive skill mature along the same trajectory, so we know how important it is for people to learn and to have the motor skills so that subsequently they can explore the environment and learn the cognitive skills, which is so much important for our, the future other functional activities that we do, the other skills that we learn, so which is important. So the motor development and the motor skills basically forms the sheet anchor on which the other kind of development takes place, right? So there has been different studies and imaging to show that motor development definitely influences the cognitive development. So I will take a pause over here because I think I was also told if we can, I can just in short cover some of basically the topic is the motor skills and motor skills, but also what actually there are some conditions that basically deters our development of motor skills. So what I can think of the conditions that primarily develop are neurological disorders, I think, which are mostly discussed. There are some orthopedic conditions also which can initially defer our motor skills development, but we develop in a bit different way. So I'll come to that. And sometimes, if long-term illness or if we are quite sick in the early part of our life, then also we see children have a bit of delayed development, right? So I think the primary group that normally is associated with delays are the neurological disorders. Orthopedic conditions are not, because they don't, there is some delay, but most of the time the children can overcome it, or there are ways to supplement it. So after some time or over the period of time, or they go for some corrective procedure, braces, and they ultimately can catch up with the motor development. In terms of long-term illness, I would say long-term illness, some illness like children who have at very early age group, they are hospitalized for long durations. It affects their motor development. But once they are out of the hospital, they are stable, and we see them catching up. So I think I will not go, you all can read it yourselves, into what is meant by neurological disorders. Basically, it's a dysfunction of the brain and the nervous system, all right? And that leads to different issues. It can be physical, it can be cognitive, emotional, behavioral, and sometimes, and that can lead to developmental issues. And sometimes neurological disorders actually behave quite differently. For example, a child with cerebral palsy behaves quite differently for a child who have ADHD, right? Because the area of affections are different, and that's how it affects the motor development. For children who may not be, for example, if you have a child with a neurological disorder, and because of the condition, the muscle and the gross motor development, fine motor development isn't there. So that's one aspect. But if you have a child who have a cognitive deficit, then what happens is, even if the musculoskeletal structure may be working as usual, but the learning ability is affected. And that's how their development is also affected. So both of this is important to have the motor aspect of development and the cognitive aspect of development. When both put together, we have a complete development of a child. So a lot of these neurological conditions that affects the development comes early in the life, and that's how the child may miss or skip, I won't say it's skip, miss developmental milestone and have difficulty developing, all right? And so some of the conditions I think you must be aware, autism, meningitis, stroke. We do have stroke in children. It's not the stroke that we have in adults, but sometimes there can be some of the brain aneurysm which can burst. There can be trauma, there can be hypoxia. So, and there are also a lot of genetic disorders. Sometimes they also result in delayed motor development. Some of the neurological conditions can also be caused by genetic. So when it comes to orthopedic conditions, I can only think of few. Some of the kids, not very common. They may have complex hip disorders. We call it the hip joints are not in place. The hip joints doesn't develop. So if it happens, I think their development is delayed, but eventually they may walk. Or sometimes they are given braces, and if the joint develops properly, then they will walk a bit later, but they will ultimately they will walk. Or their gait may be a bit different because their joints are not. Some kids have limb deformity, so there are congenital deformity. I think the common is CTEV, which is quite easily corrected. So I think by early life, within 6 months, those are corrected, or they go for some minor surgeries. So there is an initial delay, but subsequently they catch up. Some neuromuscular disorders, as we are talking about cerebral palsy, there are other muscle diseases as well. So that also leads to some orthopedic problems, which also can actually defer the development, which if treated at time, we might be able to enhance their functioning and motor development subsequently, right? So we do have some spinal deformity. We call it deformity in a kind of spina bifida. So I think a lot of you must have heard. So then they have weakness in the lower limbs, and then definitely they also develop differently from normal development because part of the muscles are weak. Perthes disease, another common condition, but I don't think this is very significant in differing the early motor development, because they normally is seen in the later part of the one child's life. So it's around 8 to 10 years when I think the Perthes may come out. So it doesn't affect the early development, because as we know that by 2 years is a rapid gross motor, fine motor development. And normally if you're looking at a child walking, so this development takes place till 6 years. So a child walks like an adult after 6 years. Till 6 years, the parameters of a child walking and the parameters of an adult walking are different. So around 5 to 6 years, the walking pattern of a child becomes that of an adult. And we know from our brain development that normally children develop 6 years. So this early part of the life is the best time for us to work with these children to maximize their potential. I'll stop for a minute.
Ladies and gentlemen, may I have your attention, please? Our visiting hours will end in 30 minutes. Our staff are advising you to report so that patients can rest. Thank you for your cooperation.
So as I was telling, that early intervention take advantage of the developing brain, because the child can learn a lot. We call it the plasticity, and early intervention supports the infant, the toddler with the development and their families. I think a lot of countries have early intervention programs. So the early intervention programs actually makes a big difference in the child development, and also because the early intervention programs actually are provided in the child's own environment. It is not at a hospital setting. So the child actually learns the skills in a setting where the child can use the skills and refine the skills. So I think I was also told to cover some of the topics and subsequently go for Q&A. So cerebral palsy is one area I think we all talk about. It by itself is a huge area to talk about. I'll just show you a video snapshot of a cerebral palsy so that you understand what is cerebral palsy and what is other two conditions that are very important. That's what Eblity guys told me to do, right? And then subsequently we can discuss some of the questions. I will stop sharing the screen. Video.
Hi, Dr. Satyaki. Swati is going to be a second.
Yep. Okay.
Hello, in this video, we're going to talk about cerebral palsy, cerebral pertaining to the brain, and palsy as in paralysis. Now, cerebral palsy is an umbrella term that refers to a group of disorders affecting a person's ability to move. It is due to damage to the developing brain, either during the pregnancy or shortly just after birth. There's three important parts of the brain which is important to know when dealing with cerebral palsy. And these three areas are the cortex, which is essentially the brain itself, the basal ganglia within the brain, and then the cerebellum. Cerebral palsy is a problem in one or more of these areas, causing abnormal muscle tone, posture, and movement. The clinical presentation. Again, cerebral palsy is a disorder that manifests shortly after birth. Early signs of cerebral palsy include docility and irritability, poor feeding, abnormal reflexes, abnormal muscle tone, asymmetrical movement patterns. But of course, these signs can be missed and thought of as normal until the baby has grown. And that is why it is important to monitor for delays in motor milestones. It is also important to know of the misconception that cerebral palsy gets worse as we age, when actually cerebral palsy is a static disorder and is non-progressive. Signs of cerebral palsy in childhood or cerebral palsy in general can be classified into three: spastic syndrome, dyskinetic syndrome, or ataxic syndrome, not akinetic. Akinetic means no movement. What's interesting is that these syndromes correlate to the brain areas we talked about at the beginning. Correlate to the brain.
That was so informative, Dr. Satyaki.
Yep.
You have
yeah. So this is cerebral palsy, and as the video highlighted, that cerebral palsy is basically classified by types, and the most commonest type is the spastic cerebral palsy, and there is quite a lot of classification as well. And because of spasticity, I think, which is the tone of the muscles is high, this actually affects the development of the child and the movement, which I think those who have come across children with cerebral palsy, and also it has a big variety. You can see children with cerebral palsy who can actually walk and run. At the same time, there are children with cerebral palsy who are really, really bedridden. But this depends entirely on the affection, how much they have been affected. The other types of cerebral palsy, those with athetosis and those which we call it as movement disorder type, ataxic is seen nowadays, but I think depending on the country, they are not seen that much, because I think the childhood jaundice, which is the main cause of ataxic cerebral palsy, is actually quite well managed in most countries, right? So cerebral palsy is one condition. So I think we will answer your questions related to cerebral palsy and child development or motor skill acquisition that you have for me later, and I will go subsequently to the other conditions that we thought we will cover over here.
That's great.
Just give me a minute.
So while Dr. Satyaki is
trying to get hold of
the video for all of you, I wanted to inform all of you, and especially to parents of children between 6 months to 5 years, we have a developmental red flag checklist available for you all to access in the Eblity platform. Our team members would be shortly sharing the link with you. So, and dear professionals as well, if you know parents who have children between 6 months to 5 years of age, they can use this developmental red flags checklist to see if their child is on the right track of development, and if or not, they need to consult a professional about anything. So, dear team members, please do share the list, the link to access the developmental red flag checklist for all our attendees. Hope that helps.
Okay, so we'll share a short video on Duchenne muscular dystrophy, right? So I think earlier part, because this takes the actually video goes into gene therapy, so which is not our discussion. Basically, Duchenne muscular dystrophy or muscular dystrophy in general is a group of disorder which is a muscle disease. So it's not a disease of the brain, spinal cord, or the nerve. It's a disease of muscle. And I think we will hear what kind of disease is that. There is another group of disorders which are called neuromuscular disorders. I think those who have heard, these are called spinomuscular atrophy. These conditions looks and the management is very similar to Duchenne muscular dystrophy, but I think these conditions do have different, I won't say management, but Duchenne muscular dystrophy have, because of the other comorbidities that they get at the later part, it's a progressive disorder. And whereas the other forms of neuromuscular disorders, they doesn't progress that much. So that affects the longevity of the child, how long they survive. Although we are seeing children with Duchenne actually surviving much, much longer nowadays, and they are active, although with powered mobility. So, so there is other conditions which are called neuromuscular disorder, which are almost like Duchenne and have the similar problems. So let's hear about what is Duchenne muscular dystrophy.
Muscular dystrophies are a group of genetic diseases that cause progressive muscle weakness and loss of muscle mass. The most common form is called Duchenne muscular dystrophy. It's caused by a faulty gene that is not working to properly produce an essential protein called dystrophin. Proteins are molecules that play roles in the structure and function of our body's tissues. Dystrophin is key for how our muscles work. Since the dystrophin gene is carried on the X chromosome, Duchenne affects primarily boys. This means that females can be carriers, typically without symptoms, but can then pass it along to children. Symptoms of Duchenne can start as early as age 3, affecting muscles that move the hips, thighs, and shoulders. Muscle weakness gets worse with age, also affecting the heart and respiratory muscles, leading to life-threatening complications, including disease of the heart muscle and breathing difficulties. There is no known cure for Duchenne muscular dystrophy. Gene therapy aims to be a one-time.
So this is, in short, what actually is Duchenne muscular dystrophy. There are different kinds also. We have other kinds of muscular dystrophies, which are called Becker's muscular dystrophy. We have some kind of muscular dystrophy which doesn't happen in adults, which we call facioscapulohumeral muscular dystrophies, which are relatively benign because only the shoulder muscles and the hip muscles are affected and it doesn't progress. And those kind of muscular dystrophies actually happen at a later stage of life, that means late 20s to early 30s, right? So other than that, today we will just hear a short about another disease conditions that I thought would be important. So we will. So that's about Down syndrome. So Down syndrome, I think, is a genetic disorder, and it also affects acquisition of motor skills. But there are other issues as well. They have other comorbidities as well. But eventually, I think most of the children with Down syndrome are, from motor function perspective, quite independent, although initially they are a bit delayed in their milestone. Let's hear about Down syndrome and subsequently take your question.
Down syndrome is the most common chromosomal condition that exists in mankind. About 1 out of every 733 babies that are born have Down syndrome, which means that about 400,000 people with Down syndrome live in the United States today. And when someone has Down syndrome, it means that they might have certain medical aspects and conditions that go with it. About 50% of people born with Down syndrome will have a heart condition, and some people with Down syndrome will have some endocrine and some gastroenterology issues that need to be addressed. People with Down syndrome sometimes have some developmental milestones that take a little bit longer to reach, and sometimes they require some extra help in the classroom. But what mothers and fathers who have children with Down syndrome say is that extra chromosome that causes it also brings a lot of lessons in patience, perseverance, and love. Chromosomes are the packages in every one of our cells that can
So basically, we have covered cerebral palsy, Down syndrome, and muscular dystrophy. So these are the conditions that I think we thought of sharing. And I have tried in a small time frame, tried to explain the development and all the factors that basically affects the development. So I'll be happy to take some questions if there is any.
Sure, Dr. Satyaki, we have a lot of questions coming in from registrants, and people, you can send in your questions live as well in the chat box. And before I move on to, asking questions from you, I would like to repeat about the developmental red flags checklist. So our team members would be sharing the link in the chat box once again shortly. If you want to access that checklist, you should be able to do that. And you need to quickly log into the Eblity platform. And if you already don't have an account, you need to register by giving few simple details. So do that, and it would be very useful for you in the future as well, because we are going to come up with a lot more resources, checklists, and assessments to help you better. Apart from that, a lot of people have been asking, as I could read in the chat box, that would you be receiving links for the YouTube videos Dr. Satyaki were just showing? Yes, we would be sending them all via email when we do share the resources. So don't worry about it. And for the people who are asking for feedback link, I think so that has already been shared. So hope I have addressed all the queries and issues raised in the chat box. So let's proceed to the questions, Dr. Satyaki. We have received a lot of questions, and we have tried to, categorize them and club the common ones so that we can address most of them in one go. So a lot of parents and also professionals have asked how to make children with motor skill difficulties walk around easily, and what gross and fine motor skills in particular do they need to concentrate on, and if at all they need to concentrate on cognitive development. So if you could elaborate on that.
Okay, so I think the best way, how fast they can progress with the gross motor skills. So normally when we are trying to treat or rather teach the parents how they can facilitate the motor development, we take a reference from the stages that I showed, all right? So if a child is initially, if we see a child who is not at, maybe by 3 months, cannot lift the head, we call it, there's a head lag. And also we see whether the child actually rolls. So we try to facilitate it. I think initially it may be good to go to a therapist who can teach, and then subsequently the parents or caregivers can do it at home, all right? So that the child learns these stages, and most of them will progress. But everybody will not progress, because the progression will also be dependent on what is the pathology, right? So we have to correlate. If it is just a delayed development, then the child will progress quite quickly, because it is just the child was not stimulated. That's why the child is a bit delayed. There isn't any underlying pathology, right? But if there is an underlying pathology, we may have to understand that. Because, for example, as I was talking, if it's a child with cerebral palsy, and we know that in some child with cerebral palsy, in babies, we have some reflexes. We call it primitive reflexes, because I didn't go to the details. So these reflexes comes with us when we are born. And as we progress, some of the reflexes are still there, but these reflexes get integrated. That means we can overcome the influence of the reflex in our day-to-day life. But if these reflexes persist, then it becomes very difficult for a child to assume a crawling position or turn the head, because the moment they turn the head, there are muscles which becomes very stiffened up, and that prevents them from learning, all right? So, how fast we can progress, it will depend on the child's condition. But to do this entire process of treatment, normally we don't need any equipment. It is purely by manual therapy or hands-on, and we can use it as home environment. We can use home things to teach them. For example, if I have a child who is not walking because maybe the child never crawled, I'll just ask the mom to move all the furniture from the room and make it so convenient for the child, maybe to put all the furniture at the edge of the room, so that the child actually can hold and walk around the room. So as the child practices that, eventually the child will be able to walk. So I asked them, then maybe make a bit of difficulty by moving the two furnitures, making a bit of gap, so that they have to walk 1 or 2 steps unsupported. All right, and gradually they will learn how to walk supported, unsupported. So these are the small things which we can do even in our home, and we don't need fancy equipments to teach them, right? So that they actually learn all these skills. Yeah.
Great. That's a fantastic technique. That, in fact, was my next question, Dr. Satyaki. So when especially parents and professionals both are dealing with children with special needs, what can they do to utilize their home setting or their environment, home or school setting for that matter, to improve the motor skills of their child? So if you could suggest some more techniques like you just did one.
Okay, so I think this also, because I'm in Singapore now, so normally with our kids we tell, because Singapore has all the people lives in flats, and they have a specific environment, they have a specific type of playground. So I ask them if they're staying, for example, a child who is learning to climb stairs, but normally the staircases, the height of the stairs are quite high, and the width of the stairs are quite narrow. So if you are learning how to climb staircase, if you get a staircase where the height of the stairs are not that high and the width of the staircase is wider, so you can climb one stair, take 2 steps, climb another stair, you can walk in this way. So personally, I know where all these things are there. So I tell, okay, which part of the town you stay, okay, this place you go, you can find this kind of, maybe you can bring a child when there's less traffic, people are not there, and practice them. You don't have to come and do. So then they are practicing in a natural environment. All right. So a lot of things can be done trying to teach kids the motor skill in the normal environment. But sometimes we do need some tools. For example, when we want to teach some of the kids some balancing skills, then we may need some tools like a big therapy ball. I think those who are attending therapy clinics have seen there's a big ball or a big bolster. It's not very fancy, but those things also helps in teaching the kids in how to control their body, or a swing, how the children can learn how to control their body in a movement where things are not very stable, because that prepares them for walking. So when we walk, we are always stable and unstable. So we need to learn how to control our upper part of the body in an unstable environment, right? So basically we can use a lot of the things that are around us to facilitate motor development. Yeah.
Great. So use the things around yourself creatively, and maybe we would all be helping the children.
Yeah.
Okay. So a lot of parents have also asked is how motor skills are responsible for the growth of academics of a child. So if it directly influences the performance of the child, academic performance per se.
Okay, so I think academic performance in terms of, it's not so easy for me to say, that's not the area of, but I would definitely say, as I've tried to cover, that the cognitive development is to a certain extent grows exponentially with motor development. But that doesn't mean that some of our children who may not achieve a certain specific motor skills will not be able to do very well in academics, because we have seen children who are on wheelchair actually does very well. Some of the children with neuromuscular disorders, they do very well. But one important thing is, once we have a child in a position where the child can interact with the environment and the world is important. That means if the child cannot walk, so it is important the child is in a wheelchair, so that the child can be straight and can look straight, look at the environment and interact with the environment. So this is the sensory stimulus that they are getting. And that makes them much more interactive, but it may not be through their own motor power, but we are taking help of assistive technology in a wheelchair so that they can move around. So in case there is a physical impairment, we always have to think of how we can overcome this with an assistive device, so that the child can actually interact with the environment, and that will help him getting into cognitive development as well. So I think for children, that's why nowadays we actually promote those who are non-walkers. We actually give them wheelchairs quite quickly, because otherwise, if they go to school, they won't be able to participate, because they'll be left out. They'll be only sitting in the class. All the kids will be going out with something else. But whereas if they have a wheelchair, they can also participate by going out with their peers. So that participation itself is important for their cognitive development and how they perform in academics.
Right. Great point. If only we could make all the children participate in multiple activities, I think so that could lead to a lot of improvement in their academic performance. So the next question is related to delays in the motor development. A lot of parents have also asked us if developmental delays necessarily mean disabilities, and what specific aspects to develop, if you could elaborate on that.
Okay, developmental delay always doesn't mean a disability, right? Because sometimes, as I have tried to highlight, because at our hospital, being an acute hospital, we see a lot of kids who at the early part of their life are quite sick. And they have been in hospital for maybe 3 to 6 months. So we don't expect them, when they go out of the hospital, if they're born and they are in the hospital for another 3 months, you don't expect them to develop like a child who has gone immediately, and 3 months they have been trained. So they are delayed because of some reason. They may have different reasons for it. So they may be delayed. Sometimes those kids who have congenital heart disease, they are hospitalized, they go in for surgery, they are weak. So their development is delayed, but ultimately they catch up. But we do have to work with them, right? But sometimes the development is also delayed because they may not practice, or there may not be enough opportunity for them to try. So in such situations, with some intervention and active participation, I think a lot of kids, they catch up. But I think all the kids normally goes through a developmental check. That means once after they're born, they go and see a pediatrician, because you need to do your immunization, right? So normally every country, when you do an immunization, they also check on their development. So these are broadly what you should do at a specific time frame of the early life. So if they are really delayed, I'm sure the pediatrician will assess them and investigate if there is some underlying disorder. If there is, then it will be treated. If there isn't, then the child most likely will take a bit longer period of time. Or where there is facility, they actually refer to us. Because we see a lot of kids who actually are just delayed, and they see us for 3-4 months, and then subsequently they catch up. And they don't come to see us. We know that they have, the parents are not concerned when they are well now, right? So they stop coming and seeing us here.
That's a great way to know. I'm pretty sure that they must be doing well. So a lot of parents have also asked us if it would affect a child, or rather, will it affect a child in doing their daily activities or day-to-day activities when they grow old, if the motor development is not good during the period of childhood?
So this is, okay. So the daily activity, how we define daily activity. So the daily activity changes with age. Right. So if I'm looking at a child who is in a primary school, and if you're looking at a child who is maybe a secondary school, the so-called daily activity is very different, what they do, all right? I think we have to take a short break because there is an announcement from our hospital.
Sure. Yeah, maybe you could put yourself on mute. I could talk to my attendees for that 1 minute. Yeah, so our team members have already shared the link to subscribe to our YouTube channel and follow the Facebook page as well. Otherwise, also, you could go to YouTube, search for Eblity, and over Facebook, you could directly type in the URL www.facebook.com/Eblity if you want to stay updated with all the resources, webinars, or group sessions that Eblity would be bringing to the community. So please do that.
Yeah. So what we call about activity of daily living changes with time. So if we have somebody who has the gross motor fine motor development is not, I wouldn't say they are capable of doing, but I think they cannot do everything, because this will depend. If there is no underlying pathology, most likely they should be able to achieve normal development. if they cannot achieve normal development, then we have to see what is the area that they cannot perform. That is, what is the inability, or we call it impairment, the word impairment. That means we cannot do. So when an impairment becomes permanent, it becomes a disability, right? So what is the impairment that we cannot do? So now if we see that this child cannot do certain things, and we don't expect the child to be able to do that specific aspect of the function, then it is best to think in terms of how we can provide the child with an assistance so that the child can overcome that impairment. So if we have a child who can sit but can walk, I give you an example. If you have a child with spina bifida who actually can walk with a crutch, but if the child goes to a higher school or university, the amount of walking within the university campus that one has to do, it is basically not practical with somebody with a crutch. Although the person can walk within a home environment or with an office environment with a crutch and can walk quite quickly. But when that movement has to be quite extensive, number one, it will take a long time. Number two, it will be very exhaustive because they use a lot of energy to walk. So it will not be an energy efficient way to perform that task. So for that specific activity of daily living, maybe within the university, we should allow the person to use a wheelchair. Then the person will be fully participating as the other members of his classmate and will not be losing out. Right. So we have to think. So we have to think in terms of the ADL, what a person can do or cannot do, from not only the perspective of whether the person can do it, but whether the person doing that specific task is practical or not. Because a lot of our children who have disability, even if they can walk, they need 7 to 8 times more energy than a normal person who walks. So it becomes really very difficult if that walking has to be over a long distance of quite long, going to one class, climbing up and down the classroom or floors, if you're doing different classes where you have to go for your practical class, you have to computer class at different levels. This makes it very difficult. So we have to think of a solution so that they can participate in the class, because otherwise they'll be too tired to participate in the class itself.
Sure. Yeah, through wheelchairs or through some support, if we enable them to participate, then there's nothing better than that.
Yeah.
Dr. Satyaki, we are living under trying and testing times in the times of pandemic. What do you suggest are the effective ways to teach motor skills through virtual mediums? And so many of our professionals want to understand about this.
Yeah, this actually has come across my mind because we also started doing a lot of virtual therapy sessions from hospital, but we have not done it with specific cohort of type of children we are talking today. But I have thought about it, how we can, because normally how we do it is we don't see them very often. But it is basically how we handle the child to facilitate the movement. So normally when, for example, I see a child, I will teach the mother to do the same thing, and the mother can do in front of me. So the mother also learns, and then the mother can go and do it, or the caregiver can do it at home. And maybe I can see after, depending a few weeks or a month, depending on what we are trying to achieve. So this part, it is possible to use some kind of it is not so easy to simulate virtually.
Right.
But we can use, means in healthcare setups, we use mannequins. Mannequins for simulation. That means how to treat a child, how to, in a simulated environment. But to be very honest, this part using a mannequin will be difficult because the way we stimulate a child, mannequin is too rigid to do that simulation. So what I can think of best is if we can have some soft toys, a mannequin like a soft toy, that can be the way we can show the parents or caregiver how to maybe handle the child so their development can be facilitated. But we have not practiced, but I have thought about it because the normal mannequins that we use in hospital is not suitable. We have medical mannequins, but they are not suitable for the specific type of work or the thing that we are doing. So we have not tried it, but what I can think of is we can have a mannequin similar to a soft toy. Then we will be able to show the parents which part of the body to hold and how to facilitate the child's maybe trying to sit from lying down. No, these are the things that the child may not be able to do. The child can roll, but the child cannot sit up. So actually, if we teach the kids, some of the kids actually, and sometimes the mothers are quite surprised that in the session itself, they learn how to sit. And the mother was worried that the child is not sitting. All right. So because these children may be delayed in development, and once we facilitate once or twice, they immediately get it how to sit, and then they will be sitting, and then they will practice. By next year, they will be able to do it independently. All right. So that part is quite spectacular when it happens actually. But how we can do is virtually is I think we need to think through and try it out. We haven't tried it out. Yeah.
Yeah, but you did suggest a good technique. Maybe professionals over here could try that out, and with some trial and error, obviously all of us can learn. Thank you so much. I wanted to ask you many more questions, but I would be taking just last 2 questions because we are running short of time. So many children with motor skill difficulties also have difficulty while writing. And a lot of parents have suggested us this. A lot of professionals have complained about it. So are there any specific exercises for motor skills that you suggest which could improve the writing skills of children?
Okay. So this is a very, very important question. All right. I can answer to a certain extent, but this is not my area of expertise. All right. Because as a physiotherapist, I have been practicing mainly the gross motor development. Fine motor development, they have also a developmental milestone, all right, which I have not covered. And the fine motor development is another area to be looked at. So which involves not only writing, which involves skills of cutting with scissor, using pencils, all right, your different kind of grasp where you can pick up objects. So definitely there is a lot of things which can be done, and it is done in a structured way. What I know that I personally don't practice this area, but some physiotherapists do practice writing skills, handwriting. A lot of occupational therapists actually practice this area. And where it comes to writing, it is not only dependent on motor skills. As our fine motor skills develop, there is another aspect of thing which we need to look at. It is called the perceptual skills. So a child who has writing difficulty should be evaluated for visual perceptual deficits. So there is an assessment that needs to be done so that whether the child visualizes the things properly so that the child can write. So it is not only writing, you have to look at it properly so that you can coordinate. So the visual perceptual skill has to be assessed. Once the visual perceptual skill is assessed, then I think in terms of strengthening muscles and training is not, but that is very important, because if the visual perceptual skill, there is a deficit, then we have to take a different strategy to train them, which I'm not expert, but I can tell this is how it happens. So after the visual perceptual assessment, so then they take different strategies to train kids to do writing. And those who can learn, definitely people improve, but some of them may not be able to attain a writing speed to that of a normal child. So what can be done is there are tests where we can tell that this child's writing ability is reduced and what percentage from that of a normal child. And normally, if the possibility exists for children who are in normal school and parents are quite worried because they feel that because their kids write slowly, they have not enough time for exams. So then we need to, with that report, we should write to the school or to whoever takes the exam, and they should be given that amount of extra time to complete the exam. So that is the normally things what is done. So then they're given that extra amount of time to complete, because even with all training, their writing speed is, is not at a normal level. So they're given the additional time to complete the exam. Yep.
Yeah, sure. That would be great if all the children, professionals and educators understand the importance of it, and these children are being given extra time to complete the exams. Okay, I would be asking my last question to you, Dr. Satyaki, for today's session. So it goes like, if you could teach how to do or perform oromotor exercises at home, I believe some of the professionals present in the audience today wanted to learn more about this. So if you could do that.
Okay, very good, important question, but it's also out of my scope, I would say. But I can tell you, as a person who have been associated with children and definitely associated working with children and with all the other colleagues that we work in KK Hospital. So the oromotor training is important from the perspective of eating and feeding, all right? So a lot of these children have difficulty in what we call is swallowing. So there is a cycle, what we call that we swallow and we breathe. So this cycle, if it is disturbed, as we know that sometimes when we have spasticity, specific muscles may be on a higher tone. So similarly, various functions of our body can be affected. So if we perceive that these children have difficulty in swallowing, and then they have difficulty in feeding, and definitely parents are concerned. So we should take help. So the people who can really help in this area are speech language therapists. I know this is quite a difficult area because everybody of us are not trained so much in this, how to manage children with oromotor difficulty. So basically, we should work with speech therapists, and there are some occupational therapists who work on this area as well, who can teach oromotor exercises so that the suck, swallow, breathing, we call it, this is a cycle, so that the kids can manage this cycle properly, and then they can feed properly and in a better way. I would. Unfortunately, I cannot give very concrete exercises because this is not the area for me to. I don't work on this area, but they should look for speech therapists and occupational therapists who really work on this area.
Right. Hope that really helps our listeners today. And yes, all of them, the parents definitely need to consult some professionals who can help them according to their individual child. And as at Eblity, we have been focused at individualized education plans. So hope that helps our parents and all the professionals out here. Thank you so much, Dr. Satyaki. It was such a pleasure talking to you today. How was your experience for the webinar?
Okay, I think I'm doing such a big kind of webinar. So for the first time, so I'm quite nervous as well. Yeah, I mean, I've been doing some webinar within our hospital, and I'm doing a lot of Zoom meetings rather. All right. So I think it's also getting to understand the technology better so that things can be better coordinated. It was my pleasure.
Totally. It was our pleasure listening to you.